that are not with us can hear this when we've finished. Welcome. It's 8 o'clock in the UK, and whatever time zone you're in, wherever you're dialing in from, good morning or whatever time of day it is. This is a little bit trial and error. It's the first one of these webinars we've done with quite so many attendees over quite so many different time zones and quite so many different presenters. So bear with us a little bit if it's a little bit slow going, but let's see how we get on. Right, I'm John Alker, I'm Director of Policy and Communications at the UK Green Building Council, and I'm steering this project on behalf of the World Green Building Council. I'm going to give you a few introductory slides, and then I'm going to bring in, bring in people that are involved with the project from various different organisations and companies. And then the aim is very much to get your input, get your questions through, and then hopefully to get a bit of a discussion going. But we'll see how that goes. And you should see in your panel on the right-hand side, you have a chat or a Q&A function, and you should be able to type in your questions and queries as you think of them. And I'd like to encourage you to do that as and when you can. Don't necessarily wait for me to prompt you. If you've got a view that you want to make known, jot it down there. Right, okay, so let me give you a few background slides on the project here. This is obviously all around the issue of health, well-being and productivity, an issue that is rapidly rising up the agenda in the world of sustainable buildings and the sustainable built environment. And the project, this World Green Building Council project, we called Measuring Impact and Sharing Best Practice. And first and foremost, I would like to thank our sponsors, our corporate sponsors, who are JLL, Lend-Lease and Skanska, and our GBC partners for the project. That's the Green Building Council of Colombia, the Hong Kong Green Building Council, UK GBC, and the US Green Building Council. I'm just going to pause for a moment because my colleague is telling me something. Thank you. Hopefully that's a bit clearer for you to see now. So thanks to all our corporate sponsors for making this project possible. And thanks also to our GBC partners who have formed the project team. Right, to the agenda, we're going to, as I say, just give you a little bit more background to the project, and I hope to be joined shortly by Miles Keeping, who's the project chair, but Miles is having some technical difficulties. If Miles can't join us, then I'll take you through that. Then we're going to look at the part of the project which is all about sharing best practice, and we've been calling this for sort of shorthand the design guide part of the project. All will become clear in a moment. And I'm going to be joined for that by Paul Appleby, who's an independent consultant from the UK, Elena Gregoriou, who runs a company called Gregoriou Interiors, Rebecca Pearce of CBRE, and then we're going to move on to the point which is all around how we actually measure health, well-being and productivity. So this is all about the metrics that we might use. And Richard Francis of the Monomoy Company and also at Gardner and Theobald is going to take us through that particular part of the project. And as I said, at every step of the way, I would encourage you to ask questions, and I've got a colleague on hand that's going to help me field some of those questions. Right, just to give you a few background slides on the project. You may recognize this slide, which is the front cover for the business case for Green Building Report, which of course was a World Green Building Council project that launched in early 2013. And this was a project not dissimilar to this in that it involved a huge number of organizations from around the world coming together, really looking at what the business drivers for green building were. And it looked at a whole lot of issues, including the perceived premium of green buildings, the potential for a green premium in green buildings and so on. And one of the most, I suppose, well-received chapters of the report that people found most interesting was all around the potential for green buildings to also be healthier buildings that encourage greater productivity of their occupants. And what the report did was point to some research that already existed, whether that was about daylighting or ventilation or whatever the issue was, individual temperature controls. It looked at some of the evidence that showed that green buildings could also be more productive buildings. And this, I think, got a lot of people very, very interested. And I think the sense was that if we could really show this to be the case, across the board, then suddenly that becomes a very, very different proposition, very different conversation that we're having with financial decision makers, with investors, with developers, and of course with end users when trying to persuade them of the benefits of green building. And so it was thought that we may want to do a little bit more work in this area, because the report said quite clearly that there's still some way to go before the sort of evidence that has been emerging really informs investment decisions, before that is really sort of brought into the mainstream. So that's what this particular project is all about. So we got together sometime around the end of 2013 with our Green Building Council colleagues to decide, how we could best come together again to take, I suppose, what you might call a deeper dive into the issue of health, well-being, and productivity, to discuss how we can overcome some of those remaining barriers and really try to mainstream this issue within the global real estate sector. And we came together, and we come together to launch this particular project. As I said, this sort of follow-up project to that initial piece of work. And we've got three broad objectives that I'm just going to take you through very, very briefly. And the webinar today will focus on the first two of these objectives. So the first one was, for the project, is to provide guidance and best practice information on features that enhance health, well-being, and productivity. And I'll come back to that again in a bit more detail when I introduce our speakers in a moment. The second was to propose common metrics for health, well-being, and productivity that people could actually use in their projects on the ground. And of course that might well involve some pilot projects, but something that would be robust, consistent, and that would enable us to gather much greater evidence and more data going forward. And then the third was to scope an online, what we called a global hub of resources on these issues, so that rather than a static report that sits on a shelf, actually we could begin to bring together evidence at the global scale that could be more dynamic and could be updated and that people could come back to on an ongoing basis. And so we're not proposing that we will create that within the next 6 months, but we will do the work that looks at what is already out there and whether that is sufficient and whether we need to do something more to create that, those resources that can be used all around the world. So we'll come back to objectives 1 and 2 as we go through this webinar, and I'll talk a little bit more about them. Unfortunately, it looks like Miles Keeping of Deloitte, who is our project chair, has been having some technical difficulties, so I'm going to continue with these slides. I know Miles will be disappointed not to be able to give you these himself, but such is the nature of these global webinars. And it's really important to say, as that box has just popped up, that the key audience for the project, for the final report and the final outputs, is not so much some of the more perhaps traditional audience that green building councils around the world deal with in terms of designers and architects and engineers, but it's that demand side, those drivers, be they end users and occupiers, or developers, and certainly landlords and investors. So it's really trying to engage what sometimes, I know for some green building councils, can be a difficult audience to engage at that sort of client end of the equation. But if we're able to engage them, then change can really be driven throughout the value chain. Little bit of a boring slide, but let me take you through it briefly so that you can understand how this is working. This is our sort of project structure, and you can find lots more information about this on the World Green Building Council website at the URL that you see there. We have a global steering committee which meets on a monthly basis to do, as the name suggests, give us just some sort of headline guidance. And then we have a technical committee which is made up of about 18 to 20 real sort of experts from around the world, a huge number of organizations and countries that are involved. And then the technical committee has sort of split itself into a number of subgroups, and it's representatives of these subgroups that you're going to hear from this morning. And those titles might not mean too much to you at the moment, but they'll begin to mean more as we go through this project. As we go through this webinar. And as I say, go to the website if you want to see in detail who is involved, because there are lists of all those that are involved. Right. So firstly, and we're probably going to spend the majority of time this morning on this part. Firstly, we're going to have a look at what we call sharing best practice. So this is objective number one that I just took you through very briefly. And the point here, of course, for that audience that I just described, is to set out in relatively high-level terms where the best research and evidence already exists, and to try to put across to the reader what the benefits are of certain design features and design strategies that enhance health, well-being, and positivity, whether that's for the individual worker or whether that is at the organizational level, of course, in an attempt to drive the business case for those design strategies that give you those positive outcomes. I should say, of course, that, and I've just realized I neglected to do so, we are focusing here on the offices. Of course, it's vital that schools, hospitals, and other types of buildings, also take into consideration health and well-being. But we felt that this was a complex issue, and we needed to start somewhere. So we have limited ourselves slightly by focusing on the office sector. In due course, in following months and years, of course, it could broaden out, and we learn where there is good evidence and good information from other sectors. We want to bring that to bear to this project, but we are focusing primarily on the office sector. So what the subgroups that are looking at best practice are doing is going through a range of different questions, and they are looking at a number of different design strategies and building features. And I'm going to ask our participants to take you through briefly the work of their subgroup to date, and also to ask your view on some of these features that they're looking at. And what each of them are looking at is the slide in front of you, effectively. They're looking at how these different design strategies, as I say, can benefit the individual, benefit the organization. They're also looking at what the links to energy and resource use are. Of course, that's a really, really important question for the Green Building Council. Is the building feature or the design strategy that is being employed, does it have a potentially negative impact on energy use in the building? Or can you find a win-win scenario? Is there actually a strategy that reduces energy or other resource consumption and also has a positive impact on health, well-being, and productivity? Is there a correlation there? And that's a really key part of this project. They're also having a look at whether there are different geographical or even cultural considerations that might encourage or discourage the use of certain strategies in different locations. Really important, of course, for the Green Building Council family, and given that this is a global project. They're also looking at what the requirements are for the user. Is this complicated technology that requires particularly careful management and relationships with occupiers, for example? And of course, they're looking for case studies, which, as we know, really good case studies, things that have worked and also things that haven't worked, are very, very valuable for people around the world. And there's one or two other factors that people are looking at that I'm not going to go into a huge amount of detail on, but I'll pick up that last point that you see there at the bottom right, innovation need. So what the groups are doing there is they're looking at these different features and saying, actually, is there a need for greater innovation in a particular technology or a particular provision of a particular service? And is there an area where we need to say to product manufacturers or architects, we've got a particular need, whether it's in cooling or whether it's in lighting or whatever it might be. We've got a particular need here that at the moment we don't have the technology or the know-how to actually be able to get those positive health and productivity outcomes and those low energy and resource consumption outcomes. Right, you've heard enough from me. So I'm going to pause for a moment, and the next person I'm going to bring in, just check my notes here, is Paul Appleby. Paul is a designer by training, a lot of experience, and at the moment runs his own consultancy. So I'm going to hand over to Paul, who is from the what we call the ambient conditions subgroup, and Paul will explain a bit more about that. Paul, if I hand over to you for 3, 4, 5 minutes just to explain the work of your group and some of the very early thinking so far.
Thank you, John. Right, can everybody hear me?
Yes.
Good. Okay, well, the ambient conditions group comprises of something like 15 or 16 people from around the world. In fact, we have representation not only from the UK, but from Australia, Singapore, Canada, Hong Kong, South Africa, Belgium, and France. So we're covering a lot of different geographical differences and cultural differences amongst our membership alone. Now, as you can see from the slide, we're covering basically the full range of conditions that impact on people's comfort and health, and consequently their productivity, absenteeism, and so forth within the working environment. It's important, I think, to recognise that there, although these are currently headings, there are many cross-cutting issues where these things overlap. And many of the studies that we are looking at, which link these with health and well-being and productivity, look at things like sick building syndrome or building health. They're looking at something, there's a general heading called indoor environmental quality. And we're looking at a whole range of studies, and there has been a raft of work here, which are looking at the links with these and productivity, absenteeism, and so forth. And some very useful studies are also looking at the costs to businesses, which I think is a very important part of developing a business case here, where we are addressing, if you like, the win-win situation that John was referring to earlier, where not only do we create a better building environment, but an environment which is cheaper to run, and the cost of productivity losses and absenteeism to businesses across the world is in the trillions of dollars. And so it is to every individual business that suffers from a poor working environment, there are massive payroll costs or massive losses in output that a lot of people essentially are not aware of because they accept it as being the norm. So it is clear that the cost of labour can be a significantly greater the investment required to improve the indoor environment. This has often been used as an argument for air conditioning. But this is where one of the conflicts lies, because much of the work that was done in the 1980s and 90s came up with the fact that air conditioning is very unpopular with a lot of people, particularly in the public sector. A lot of work that was done in the UK demonstrated this. But I think this is probably largely due to the fact that the air conditioning involved was old, poorly maintained, and not being run properly, and the buildings were very poorly designed. So these are the kind of issues that we're trying to get to with the output from this project. So I think probably that can draw that particular slide to an end, John. Thank you very much.
Okay, thanks, Paul. I'm going to again encourage those that are logged in. If you've got any questions in this area, now would be a great time. I'm happy to obviously come back to questions at the end, because I think probably people want to see the picture evolving. But if you do have any comments or questions, I mean, please do feel free to write those down. Okay, I'm going to move us on to the next slide. Bear with me a moment. Which is, and this is the subgroup that is looking at spatial features. Now then, my colleague who is dealing with this, Elena, is sitting next to me. So just give me a moment, and we're going to try to make sure this works.
Good morning, everybody. Can you hear me? Okay, fantastic. Thank you very much. So I had some technical issues with my laptop, so I could hear, but no one could hear me. So John, you can't hear John now, so I've got Nick control. So good morning, everyone. And okay, it's fine. So a little bit about what we're looking at in the design character and spatial features. So we've been very careful not to overlap in any sort of indoor air quality and sort of external provided issues that have to do perhaps with from a building and outside. So as we've stretched the parameters at the moment, and we're at a point where we've defined everything or itemized and specified everything that is starting from the reception area pretty much coming into a building, and then looking at circulation through, so that picks up active design. So when you're coming into a building, are you inclined to go straight up the stair first of all, or are you going to go into the lift? Can you see where the stairs are to start off with? And are they in a condition that actually encourages people to come into that space and use it for what it was intended to use? So we're at the stage now where we've kind of broken down all the different categories and different issues that come into play. I am going to just touch upon each and every one of these listed at the moment to give you a sort of a flavour about the issues that I captured. There are quite a lot. So let's start with design character. So, and this is different to sort of physical arrangement. To give you a flavour, design character is about a cohesive design look and feel around the space. So how has a colour, a texture, a volume, or a line approach been continuous and actually intended throughout an environment, and then what's the final design look from that? How does that make us feel? Does that make us feel more valued? Does that give a look that actually looks coordinated and of quality? And then how does that make us feel from a psychological point of view? So that picks up psychology and environmental psychology in specifics, which has been quite a big issue and has a huge impact in how we all feel and react to certain issues that are at play or not at play. So just to highlight, I think refuge and prospect being one of those. And we see that all the time. We do that as a human being all the time, where we choose to sit, where we choose to actually lay for a little bit or whatever, choose to sit in a coffee shop or choose to work in a hot desking environment. And it's about making sure that every workspace actually does meet that need. So we're sort of looking at how does that happen, what kind of benchmark would that look like, and then how does that impact in relation to others also, other issues, the effect such a designing feature will have. Now, a lot of these issues aren't necessarily meter readings. They're sometimes seen as subjective and qualitative measures, and that is the case, but there is a lot of data there, and actually you are able to judge something being implemented or not implemented. And there is, and John was talking earlier on about where there's a need for innovation. This is one of the areas. There's very little data and evidence behind actually applying some of these what people have classed more airy-fairy issues when it comes to design, but they are significant influences. The other issue that I'll pick on is the physical arrangement of furniture. Perhaps more familiar with this kind of issue than things like views out. So I think that's an issue everyone's quite familiar with because it's been in BREEAM and in different environmental assessment methods. So that's definitely something that's coming into play. And art and culture, again, something that John touched upon earlier on, very important. But it's not just location, geographical location, it's also professions and the different activities that are taking place within each profession and each company's product, especially when it's a knowledge-based company, from a legal company to a tech startup. And this battle constantly about, oh, the open plan is not appropriate. That is not the case. It's about designing appropriately for each company. So that's something that we hope we can actually deal with the information as an issue, I think, and as a challenge to the industry discussions taking place with what we're touching upon, and also age and ability. So these are other issues that do get forgotten many times when we're looking at attractive, I'm going to call them Google-esque environments. So we must consider that. We have a very wide range of employees nowadays, getting wider all the time, and knowledge is what we're trying to get out of them. So these are very important issues. But I think that's okay.
Great.
Okay, thank you.
Take my microphone back. Right, thank you very much, Elena. I think that it's particularly fascinating group that you're working with. Right, third and final group in terms of the best practice subgroups that are looking at amenities and location. So this is where I want to bring in my colleague from CBRE, Rebecca Pearce, who is chairing this particular subgroup, to take us through how you're getting on and what are some of the things that you're looking at. Rebecca, can you hear me?
I can. And can you hear me?
I can. Go for it.
Excellent. Hello, everybody. Good morning, good evening, good afternoon, wherever you are. The Amenities and Location group consists of around 10 people from across UK, Europe, Asia, Australia, and the USA. We've got a really good balance there. And we are looking at things, whereas Elena described things from reception inwards. Oh, I think I've just, yeah,
no,
sorry,
we can hear you.
back. Oh, that's good. From reception back within spatial features, amenities and location, we are looking at, in most cases, from the external wall out. So not looking at roof terraces, balconies, access to nature, that sort of thing, but anything outside the building. So external features, and we've got a list here on the slide of a number of different groupings of factors, but we have a lot of factors that are under consideration. Just to take you through those, for amenities access, we're looking at a lot of the thing is to do with time for people, time for employees, so providing easy access to healthcare, retail and services, and childcare is under consideration. Also looking at access to fitness and recreational spaces. So that's both well-being related, but time related as well. So obviously if you have employees spending less time getting to and from things, running their errands, etc., they will have more time and less distraction to be applied to the workplace. Transport is fairly obvious. So we're looking at a variety of transport access available, whether it's a purely car-related environment or whether there is access to public transport what is the travel time and reliability of that public transport that is available? Is there potentially some private access of mass transit provided, well, sort of mass, but like the company bus that picks up from various areas? And also built into the transport section are facilities around cycling. So locations around cycle paths, shower facilities, cycle storage facilities. This is the one area where the facilities may be within the building, but equally they may be outside the building as well. So we've considered that in the amenities and location group. The quality of public realm considerations are around security and safety around the workplace building, the tidiness, cleanliness of the environment, the quality of the architecture and the landscaping around the building. Now, these are things that are going to be very difficult to measure, I think, because a lot of them may become value judgments, but we are looking into how those things get measured and how they get judged, and indeed how they impact people's everyday experience of the workplace. Connectivity to nature may be one of the more obvious things for this group, and we're looking here at the biophilia kind of access to natural environments, whether they be purely natural or green environments from a public park facility. I think it's been, I mean, this is the area that I'm looking into in this group, so it's the area that I probably know the most about so far in terms of the research that's been done. But there has been work around in the healthcare environment, patients recovering faster from either viewing or having contact with nature, students learning better, and ultimately there is some work around workers being more productive in a call center and research environment. So we're looking into that in a bit more detail and how that can be included in building decisions and workplace decisions. The equity, economy and community group is perhaps a little less obvious. In this group we're looking at access for disabled people, the idea of a mixed-use neighbourhood rather than a purely commercial or a purely industrial neighbourhood, for instance. We're looking at integration with urban areas and the ability to access external spaces for interaction, either with your colleagues in the workplace or colleagues from other businesses in the surrounding area. And finally, our final grouping is around local and sustainable food and beverages. So this is really playing to the well-being card, looking for access to healthy food options, maybe even some edible landscape, and most definitely access to clean and fresh water, which might sound very obvious sitting in central London looking at St Paul's, but in some areas of the world, not quite so obvious. And that really wraps up our considerations. We're proceeding through looking through the various metrics and research on and case studies on those at the moment.
Great, thanks Rebecca. I like the idea of an edible landscape. I know that there's over 60 people logged in, and yet people are being very, very shy with their questions, which is fine. That's your prerogative. But I would encourage you that we've only got about 15, 20 minutes left. So if you do want to get a question into our panelists while they are here and live, then now is your opportunity to do so. But let me also just take a moment there to say that we plan to have a more formal consultation period. This webinar won't be your only opportunity. And we will do that in written form. So I can't tell you exactly when that'll be yet, but it will be in a matter of days rather than weeks. And we will put out a number of papers showing some of the work to date and will enable Green Building Council members from all around the world to express a view in writing and to make sure that we aren't missing anything, there aren't any gaps. Okay, so what we've heard from, or who we've heard from there, are people involved in the 3 subgroups that have been looking at aggregating and sharing and communicating best practice and the evidence and research and case studies that already exist to try to elevate these issues and bring them to a mainstream audience. But the fourth subgroup, in a way, cuts across all of those issues that we've heard about, and seeks to address this barrier that we identified through that earlier report, and that we've referred to a couple of times, around how we actually measure health, well-being, and/or productivity. And of course, there's issues there in terms of exactly what we're looking at in projects. So let me bring in at this point Richard Francis, who is chairing this particular group. Richard, over to you.
Thank you, John, and good morning, good afternoon, good evening to everybody who's joining us from around the world. I'd echo John's request that either now during the webinar, or if you're like me, you take things away and want to reply later on, please come back to our group. Our group has noticed that our reporting on this and our product gets better the more people join in. So please take advantage of that, whether a consultation or somewhere else. I'm going to speak to the next two slides. One, our task is to develop the metrics. You'll see that slide coming up in just a moment. There we are. And the second thing we've been asked to do is to assess the metrics. So two main tasks, which is the more difficult really is this first slide, I think, which is we're not in a hospital or a learning environment where there are some more directly measurable outcomes or metrics that you might be able to look at. It's notoriously difficult to measure productivity in an office, for example, and although getting easier, and I'll speak a little bit about innovation in just a moment. We started out with a review of the previous reports and a literature review, and what we came up with in the beginning were about a dozen or so conventional measures of health, well-being, and productivity. In the time that our group has been together, which is now just a little over a month or so in a real fashion working on this, we've managed to move that number of metrics up to about 40. So you can see that, that we're expanding our definition of what metrics are and also their application. In order to make it manageable, we've decided to group these into 4 categories, which you'll see on the screen there, which are the physical measures, which in some sense mostly relate to health, but not always, and mostly are directly measurable, either in terms of directly reporting them or directly measuring them. So you see things like physical measures of headaches and eye strain, depression and stress, which is a little bit harder to get at for sure, sick building syndrome and SAD. We also have a few more measurable ones which aren't there, things which are a little bit newer and not as applicable across all kinds of offices, but things like the measurement of heartbeat and the measurement of cortisol levels, pushing the boundary a little bit in terms of the kind of things that we can measure directly to understand the effects that buildings have on people. The second group, working from left to right, we have is our perceived measures, because we all know that what objectively is the case and how you feel about things, well, they're often two different things entirely. So we're looking at and considering ways of developing metrics to look at perceived health and perceived productivity and perceived well-being and organizational climate. So these would be, we envision mostly gathering through surveys and asking participants how they feel about their particular condition within offices. The third, and I think is probably the most difficult, whenever there's a parentheses after something, you can tell that it's difficult to find. So we're looking at productivity or proxies for productivity within the office environment. Now, some of these are well established in the literature and tend to be task-based, and you're probably all familiar with the idea of number of calls in the call center or number of claims processed. We're looking at those for sure. But we're also aware of the criticisms of those. They don't apply to all kinds of offices. They're slightly a bit antiquated. They don't capture productivity in a modern office, and so on and so forth. So what we're looking at are some of the conventional ones, which are time off work, and also things like revenue per employee and deadlines met. We're also looking at a few more things like cognitive performance and medical costs. And here's one place where I'd just like to measure some innovation. One of the things that this group is looking at and following with a little bit of an eye towards the future are things like wearable technologies, smartphones, and big data. Most of you on the line are familiar with there are a number of studies which tend to be sort of study-based at the moment, but there is the idea that we might be able to measure productivity using some devices which currently aren't well deployed throughout the market. And the last area we're looking at are external measures, which are things like customer satisfaction. And these are more looking at the organizational level rather than the individual level. As you move, as we have on this slide from the beginning, we're mostly talking about individuals and impacts on individuals. The external measures are impact on organizations. Things like customer satisfaction, customer waiting times. These are for organizations which are public-facing and can measure these things. Brand image, a little bit more difficult to get at, but suggested by the members of our group. And things like the cost and level of complaints. Are they going up? Are they going down? What does that mean for the revenue or the image of a building? I should have mentioned at the beginning that this group, like the other groups, is well represented from around the world, and also professionally diverse as well. We have academics, and we have more academic practitioners, and then we have people in the business world looking at these things from a business point of view, because it's no accident. It's been mentioned in this call before that this is the area. The metrics and the measurements, particularly around productivity, are what are going to make or break the business case for this particular problem. If we can move on to the next slide. It's how we're doing it now. Having got to about 40 odd, we're going to have to start trimming them back down to the kind of things which are demonstrable in the real world, shall we say. So in assessing the metrics, we want to know a little bit more about them, not just, can they be measured, because that's useful, but it's not particularly telling, because if they can be measured but only in a controlled setting, or if they're not being measured by organizations, they are less useful to us. So I'd like to take you in this slide through the sort of screens that we're putting the metrics through. First is trying to identify whether they relate to health, well-being, or productivity. Now, it's often the case that health and productivity and wealth and productivity are connected. Certainly they are. So we're not saying that they're mutually exclusive, but we're trying to identify what the major impact is. We're then trying to understand the outcomes for the particular metrics, both at the individual or the organizational level. Obviously, the individual tends to be around health and well-being, and the organization tends to be around productivity. But again, those categories blur a little bit. We also want to make sure that our metrics are applicable, or at least understand whether they are applicable across a range of businesses, cultures, and locations. It's been pointed out to us a number of times that things like changing jobs are quite common in some parts of the world and not less common in the other. And you would be making a mistake if you thought that an organization was losing people because of its facility, for example, when it's quite common in that part of the world for people to shift jobs often. So we're trying to put a measure of geographical screen on that. We obviously want to know whether these things can be measured easily, the degree to which they can be related back to building features. Just a note on this, we are trying to tie our metrics and our outcomes back to the other three groups wherever possible, but we're also aware that perhaps we might be able to capture some metrics and some productivity measures around productivity, health, and well-being, which have multiple causes. And so we want to look at the metrics slightly independent of the building features, but wherever possible back. Consistency of measure is obviously important, so that if we make some recommendations going forward, we can make sure that what we are capturing is consistent across the board. The causal agent is a difficult one, but we've got it in there anyhow. So if, for example, we know that something like lighting can lead to headaches, it's pretty easy to draw that arrow backwards. It's a little more difficult for some other measures, of course, which might be sort of multi-cause, but we're going to try and do that wherever we can. We're going to look at what tools are on the market, and by doing that also develop some references to research and case studies, which will tell us where this has been done. The HWP is the cost to the organization. We'd also like to look at the cost of doing research, because one of our things that we're going to be doing here is making recommendations for people to take what we find and work it in their own organization or in their own universities, for that matter. And so it would be helpful to know whether the research to do this or the studies to measure these kind of things are expensive or inexpensive to undertake. And lastly, on this slide, we'd like to look at the manifestation time scale, is what we call it. So we know, for example, that some metrics can be measured immediately. You get a headache immediately after some causal factor or related causal factors. Some things like VOCs or some later health impacts, they might take some time to manifest themselves, and we want to make sure that we're telling people that if you don't see it in the first year or two, it may show up some point later on, and we're looking to other literature to help inform that kind of decision. So broadly speaking, we have two main tasks: looking at what the metrics are, and then trying to help organizations understand how they might implement them in their particular circumstances. John? Over to you.
Great. Thank you, Richard. Thanks. Right. Now we've got some questions coming in, and we've got about 10 minutes left. This is always the dangerous part of the webinar, where I start reading questions out that I haven't had the chance to read in advance. So hopefully nobody is being rude. People are saying, someone is saying, thanks for the webinar. How very nice. Very interesting, of course. Okay. Let me just pause at a moment, and I have a look through. Okay, fair question. How will the committee tackle design elements and strategies that do overlap across technical areas? The example that comes to mind is indoor plants. Subject of plenty of good debate amongst international indoor air quality scientists at present, even though it may make us feel good psychologically from a spatial feature perspective. There's still considerable debate as to whether that impacts regarding health, well-being and productivity. There will be an opportunity to analyze the impacts of these types of design elements that may clash across technical groups. That's coming from Jack Noonan. Fair question. Let me see, who shall I bring in on that one? I'll bring in, well, Paul and Elena, if we can unmute Paul and Elena. Paul, well, no, actually, let me do Elena first. I'm pretty certain that you're going to be, I'm pretty certain you're going to be taking into account plants, is that right?
Yes, we will. Yeah, there we are. I think we're looking at it more broadly under biophilia in general. It's okay, I can hear. So we're looking at the effect we have in our reaction to nature and our link to it. So indoor plants are just one element. So you can insinuate natural flows, materials, and links with nature through the shapes of objects and imagery and views out. So plants is just one issue. Now there's different ways that we're affected by everything, and the same thing applies to color and color psychology, and the same thing with plants. So you've got the biological reaction of more moisture in the air. So chemically, you are breathing air that has a different consistency. So that will immediately affect your reaction. And then you've got the actual psychological effect, which is your karma, your path goes down because of what you are seeing and interpreting then cognitively. So there's different ways, but I don't think they're clashing at the moment. I think the particular issue is not necessarily clashing. But I know that there are some issues that on one issue could be seen as reducing well-being, but I think that's where it comes to play, the actual area and the tasks taking place and what's appropriate to those, rather than one issue is good or bad, full stop. It's completely relative to where it is and in relation also to other issues, because it's through the combination of issues that we actually see a result, not in isolation.
Yeah.
Okay.
Yeah. Can I come in on that? It's Paul here. Yeah. There's no doubt that there are quite a few cross-cutting or linking issues between the groups. This is one of them. We will certainly be looking at plants within the context of indoor air quality and their ability to absorb chemicals and what evidence there is out there for improving the quality of the indoor sort of particulate and gaseous levels. But also to answer the question about how we're going to make sure these don't clash between the groups, this is one of the jobs of the technical committee, which is taking an overarching view of the activities of the various committees. Things like view and daylight, for example, which are within the ambit of a number of the groups. We will be merging the considerations when it comes to the final publication.
Thanks, Paul. Paul, while I've got you, while I've got you on mic,
yeah.
I think this is an interesting question that's come in from Carsten Pedersen. My experience is that a lot of buildings are becoming very energy efficient, but compromising comfort. Is that part of the research? And I think that probably goes to the heart to an extent of what your group is looking at. Do you want to? I know it's a complex issue, but do you want to comment on the relationship there?
Of course, yes, it's absolutely fundamental. There is no doubt that when you seal buildings up and create a much more controlled environment, there are negatives as well as positives, and we will be looking at how we deal with that in terms of making sure that the quality of ventilation air, for example, is maintained when you're relying entirely on mechanical means for circulation. Also, the potential for overheating needs to be addressed in naturally ventilated buildings, where there is, of course, a trend towards avoiding air conditioning in many parts of the world. So these are all issues that are very fundamental to the kind of clashes that we are looking at within the groups.
Okay, thanks, Paul. Elena wants to come back in on that question.
Thank you, Paul. Just an issue, I think, on what you were just saying now about how the buildings are compromising comfort. I think one issue that we do need to acknowledge and perhaps investigate, or maybe you're already doing it, is how as users we're also reacting to the building and adapting, because I think we've come to a stage now where we're expecting the environment to meet our needs 100% the whole time, and every user, when we're different bodies, we're wearing different clothes, and we will feel different at every moment. So where in your work at the moment are you, or maybe it's something that you think you should do, pick up how as users we're responding to adapting our comfort based on the building's ability?
Yes, thank you, Alina. That is an extremely important point, which we're looking at from the point of view of the user interaction. One of the headings that John referred to very early on in one of the slides was user interaction. We had a heading under each of our subheadings. We had an item dealing with controls. And the way in which people adapt to their environments is very important. The way in which people interact with their buildings is very important. And one of the issues is to do with the way people learn how to interact and how to use their building, particularly in open plan offices, for example, where there are potential clashes between neighbouring workstations. These are all things that have a potential negative impact on the way in which people respond to their buildings, particularly when you have people close to windows which are openable and neighbours who are further away, who has control over the windows, who has control over the thermostats, and so forth. All of these interactions are things that we will be addressing. We won't necessarily have answers to, but I think a number of under the innovation heading, we will be looking at what's being done at the moment and how this can be, provide guidance on how this can be addressed.
Okay, thank you, Paul. Just a quick reaction from Carsten, who I think originally asked that question. He said training of the users is, of course, essential in making the building work as intended. I have had a question here which I wanted to come to Richard from another Richard. I'm sorry, I don't have that's your surname, Richard Buhari. Could the metrics done for a renovation? Could the metrics also be used for a renovation? I think that's the question, because that's the best proof to measure impact before and after. Richard.
It is. Thanks, John. It's a good question, and it's our ideal situation, actually, as we take this forward. We are aware of this halo effect that new buildings have, and so obviously the best way to test the intervention of these variables is a before and after. And if you're talking about a renovation, in an ideal situation, you're keeping the people the same, the location the same, and you're changing the inside of the building. And so, by all means, we would like to use a renovation to test these and to understand them. And as an outcome of this, we'd like to be able to make some recommendations ultimately about the kind of renovations which are likely to foster health, well-being, and productivity in the workplace.
Thanks, Richard. Really interesting point from Mark Gero, who I think is in Croatia. I think I'm going to probably keep this as more of a comment because I've got my eye on the clock. But this is incredibly timely in terms of where the project has got to at the moment. He's saying that most of us spend too much of our time preaching to the choir. In Croatia, we're still mired in. Sorry, I'm just going to pause. Can you mute Richard? Mark says in Croatia, we're still mired in recession, and the building industry was and is one of the hardest hit industry. They need bottom line numbers to take to owners, developers, investors, and the earlier World GBC report helps. He's saying we need to translate these percentages, e.g. lighting and individual temperature control, to cost per square meter. So we can show the financial decision makers, if you do this, then you're likely to earn X per square meter, etc., etc., etc. That's what we're hungry to have in hand, the most recent data. Now, I think that's a great question because this is, there are studies that have, to a degree, and we're picking those up, and we will be sharing those. The extent to which I think we can aggregate those studies and I guess make some new headway in a robust way along those sorts of lines is a topic that we are considering at the moment. I mean, I think we're erring on the side of caution because we absolutely don't want to be bringing something forward which we can't back up or is seen to go too far too fast. But equally, we know that that's something of a holy grail that people want to be able to show, and therefore, we will summarize the research that has begun to do that. I don't think I'm going to take any more comments on that just now, because as I said, that is something that is, in fact, it's being discussed by the steering group in a call that we have this evening. So I think, Mark, you've kind of got to the heart of the issue with that particular comment, and I'd be very grateful to hear more about that from other people around the network, as I say, on the consultation to follow. I'm just going to have a quick scan through. Another Grigoriou, Angeliki, is asking, once the project is complete, is there a plan to communicate it with clients, and/or are you thinking of involving them at some point and get their view on whether these findings will influence their decisions and investment, etc.? Yes, Angeliki, yes to both things. I mean, we already have clients involved in the project. So, I mean, we've got people like Tishman Speyer, British Land, who are involved, for example, with Richard's metrics group, and are very much coming at this from the perspective of, we are not experts in health, well-being, and productivity, or indeed in how you measure it, but this is how we would like to use the outputs. So we're getting that input from right the way through, and we're putting in place hopefully very comprehensive communications plans when we complete the project, and I'll come on to that in a little more detail in a moment. I'm just having a quick look through these questions to see if there's any others that I can pick up in a minute or so remaining. I can tell from the names of those people asking questions that they're coming from all around the world. Just bear with me a moment. I mean, there's one or two questions that have come in about building rating tools. And I guess if I just sort of summarize on behalf of others, if that's okay, we absolutely are drawing on building rating tools to use the way they classify some of the sort of design features and strategies as an aid to working through that best practice guidance. And it may well be, of course, that there are recommendations that come out of the work that we can take to those tool providers, which hopefully will be of use. And of course, with many of the tools Okay. Sorry about that. I went quiet for a moment. With many of the tools tools, of course, being owned and administered by GBCs, clearly we're well placed to do that. And BRE, who of course run BREEAM, are also involved on the technical committee. So hopefully we're sort of working hand in glove with the tools providers. I'm sorry if I haven't been able to read out your question, because a lot have been fired in right at the end there. I'm going to draw this to a close, though, and I'm just going to take you through one more slide, which just repeats a little bit of what I've said. We will come out with a sort of formal consultation to put out around the GBC networks shortly, so please get involved with that. We're going to have a period of piloting the metrics in quite a rough and ready process over the summer. So if you are a landlord, or indeed if you're an occupier perhaps with multiple offices, and you see an opportunity for helping us to test some of the emerging metrics, don't worry, it won't be all 40, it will be a greatly reduced number. Let us know, please do get in touch. And of course there'll need to be further more formal testing of those proposed metrics when we actually do release the report. And the report, as I've sort of inferred a couple of times, the report and the resources around it will be published this autumn. You won't pin me down on a date just yet, but hopefully around sort of late September, October, we'll be publishing this. And then, of course, we'll be doing work to establish exactly what a sort of global resource hub might look like, whether that's piggybacking on things that exist already or whether that's something new. We're not going to reinvent the wheel, but as I said at the start, we want this to be a dynamic resource, not something that gathers dust on a shelf, and we want it to be helpful for you, for GBCs, for people all around the world, getting that message across to clients and for those that can really drive healthier, greener buildings right throughout the value chain. Okay, I'm a minute over, so I'm going to wrap this up. Thanks to everybody that has dialed in. It's great to see so many people do that from all around the world. And a very big thanks to our speakers and all of those who are involved in the project at the moment. Thanks very much. Bye-bye. Thanks, everybody. Really appreciate it. Talk to you in due course.
See you tomorrow, John. Oh, John's gone.
John is gone. Quick. See you guys.
Ooh.
Bye.
Bye-bye, everyone.
Ciao.